So, good day to everyone. I'm going to report about pain mechanism and theories. Pain is a perception of an unpleasant sensation. Painful stimuli stimulate specialized receptors called nociceptors. Nociceptors are free nerve endings. There are three types of receptors activated by different noxious stimuli. First is mechanical nociceptors. They are activated by mechanical stimuli thermal. Second is mechanothermal receptors. They are activated by stimuli that cause slow and burning pain. Third is polymodal receptors. They are activated by mechanical stimuli as well as temperature. Afferent current pain sensations. Information regarding fast and acute pain sensation is conducted to the CNS or the central nervous system by small myelinated fibers. Conduction velocity in these fibers is much faster than that of C fibers. Slow, chronic pain sensation is carried to the CNS by unmyelinated C fibers. Both type of fibers enter the spinal cord at the apex of the dorsal horn branch and then ascend and descend for 1 to 3 segments to enter the dorsal horn. Anatomical pathways mediating pain sensations from the body. The cell bodies of sensory neurons mediating pain are located in the dorsal root ganglia. The nociceptors represent nerve endings of the peripheral axons of the sensory neurons located in the dorsal root ganglia. The central axons, both A and C fibers of these sensory neurons, reach the dorsal horn and branch into ascending and descending collaterals, forming the dorsolateral tract of Leisure. In Leisure's tract, these fibers A and C ascend or descend a few spinal segments, enter the gray matter of the dorsal horn, and synapse on neurons located in laminae 1 and 2. The neo-spinothalamic tract is the major ascending pathway involved in conveying pain signals to the higher centers. It arises from the nucleus proprius. Anatomical pathways mediating pain sensation from the head and face. The main circuits mediating pain sensation from the head and face are the trigeminal thalamic pathways. Here are some pain syndromes. First is hyperglacia. This results from tissue damage and release of many endogenous chemicals. Next is phantom limb pain. When a limb is amputated in some people, they experience a sensation of pain emerging from the missing limb. Causalgia, or the sympathetic dysotrophy syndrome. The burning sensation in causalgia is caused by increased sympathetic efferent activity after a peripheral nerve injury, usually median or ulnar nerve, or less frequently sciatic or personal nerve. Neuralgia. Neuralgia is characterized by severe, persistent pain in the distribution of a cranial or spinal nerve. For example, in trigeminal neuralgia, the pain, which comes in episodes and feels like stabbing, is precipitated by activities such as eating and brushing one's teeth and is limited to the sensory distribution of the trigeminal nerve located in the face. Excuse me. Next is thalamic pain syndrome. Lesions in the posterior thalamus may cause chronic pain in some patients. The etiology of thalamic pain syndrome and its nature are poorly understood. Next is referred pain. Referred pain, sometimes pain arising from the deep visceral structures, is felt at sites on the surface of the body. For example, pain stimuli arising due to the myocardial ischemia are felt radiating to the sternum, arms, and wrist. This is called referred pain. Headaches. They are broadly classified as primary and secondary headaches and cranial neuralgias. The primary headaches include tension headaches, migraines, and cluster headaches. The secondary headaches are caused by numerous factors such as head or neck trauma, cranial blood vessel disorders, or infections. Cranial neuralgias are the result of nerve pain in their head region. The first type of headache is a tension headache. This is the most common type of headache characterized by a dull pressure-like pain in the head neck, and scalp, it typically develops early in the day and is more common in women. Next is migraine. This is the second most common type of headache. It is more common in women and individuals between 15 and 55 years of age who have a parent or siblings suffering from this condition. Migraine attacks often include the following features. First is prodromal phase. It is characterized by a change in mood that begins hours or days before the headaches and includes symptoms such as depression, sleepiness, talkativeness, and restlessness. Second, aura characterized by visual abnormalities, such as shimmering spots or stars, zigzag lines that floats across the patient's fields of vision, blind spots, flashes of light, blurred vision, loss of vision in one eye, numbness or tingling in parts of the body, dizziness, and speech problems. Third is a headache phase. The headache itself may typically start at one side of the forehead but may affect both sides of the head. The pain starts gradually and may last from 4 hours to 3 days in adults. The headache is often accompanied by loss of appetite, nausea, vomiting, sensitivity to the light and sound, blurred vision, and tenderness of the scalp or neck. Next is the cluster headache. This condition is characterized by a cyclic pattern of headache. The cluster may last for weeks or months and then stop completely during the periods of remission, which may last for months or years. The patterns of clusters varies among the patients. Cluster headache is one of the most painful types of headaches. The symptoms include intense, sharp, burning pain, generally located in or around the eye, but may radiate to the other areas of the face, head, neck, and shoulders. Next is the sinus headache. This condition often accompanies inflammation of the sinuses or the sinusitis caused by colds and allergies. The symptoms include pain over the cheeks, forehead, and sometimes eyes. Last is post-lumbar puncture headache. This type of headache may appear 1 week after a lumbar puncture to remove some cerebrospinal fluid or the CSF. Decrease in cerebrospinal fluid pressure is believed to precipitate this headache. The headache usually disappears within 2 weeks. Sitting in an upright position, standing and straining during cough exacerbate the pain, whereas lying in a recumbent position relieves it. Thank you everyone, and that's all.